Stories pop up all the time about travelers having their medicine taken by airport or border officers. The most common culprits are often medications for anxiety or even simple sleep aids. Imagine the stress of finally arriving at your destination, only to find the one thing you can't buy at a gift shop is gone. Or trying to explain your medical history to a customs agent who doesn't speak your language. This isn't just an inconvenience. For millions, it's a real health risk. The rules are confusing, they seem to change constantly, and they're different everywhere you go. What's perfectly fine in the United States might be a controlled substance somewhere else, with penalties ranging from confiscation to jail time. In this video, I'm going to give you the ultimate step-by-step guide to packing your medications for any trip. We're covering everything: liquids, pills, medical devices, and the international landmines you have to avoid. By the end of this, you'll be more prepared than 99% of the people in that security line with you. Body. Chapter 1. The number one mistake that can wreck your trip. All right, let's kick things off with the single most important rule. If you forget everything else, please remember this. Never, ever, under any circumstance, pack your essential medications in your checked luggage. Do not pack your meds in the suitcase you hand over at the check-in counter. This is a gamble you just can't afford to take, and here's why. First, checked bags get lost. It's a fact of air travel. While the stats have gotten better, thousands of bags are mishandled every day. Losing a bag with your sweaters is an annoyance. Losing a bag with your heart medication, insulin, or anti-seizure meds is a full-blown emergency. You can't just walk into a pharmacy in another country and get a refill. In many places, a U.S. prescription is just a piece of paper. You'd have to find a local doctor, get a new diagnosis, and a new prescription, all while your supply is running out. But there's a second, more common trap: gate checking. You've seen it happen. The flight is full, the overhead bins are packed, and the airline staff starts making people check their carry-on bags at the gate. Suddenly, that suitcase you carefully packed is being taken away and thrown into the cargo hold. If your meds are in that bag, you've just lost access to them for the whole flight, and you're now facing that same lost luggage risk. This is why you need to make a crucial distinction. When I say don't check your medication, I mean you need to keep it in your personal item. That's the smaller bag, your backpack, your purse, your laptop bag. That's guaranteed to stay with you right under the seat in front of you. That bag won't be gate checked. It won't leave your sight. It is your medical lifeline. All essential medications belong in that personal item. It's the only way to be 100% sure they arrive with you. Now that the golden rule is set in stone, let's get practical. The medical go-kit strategy. This medical go-kit strategy is all about being organized and transparent. The biggest mistake people make is just throwing their pill bottles into their toiletry bag with their shampoo and deodorant. That's just asking for a messy search at security. Instead, you're going to create a dedicated, separate, clear bag just for your medications and medical supplies. Think of it as your personal medical bag. This is not your 311 liquids bag for toiletries. This is a completely separate pouch. A simple quart-sized Ziploc works, but you can also find durable, clear travel pouches online. Why does this work so well? Because it immediately tells the TSA officer what they're looking at. When they see a clear bag filled with labeled pill bottles and inhalers, it removes all the guesswork. They're less likely to mistake your medical liquids for a big bottle of shampoo. It shows you're an organized traveler who knows what they're doing. Inside your medical go kit, you'll keep everything health-related. Your prescription pill bottles, your over-the-counter pills, any liquid medications, which we'll get to in a minute, inhalers, EpiPens, or other injectors, small supplies like testing strips or lancets, even your gel packs for keeping things cool. When you get to security, just pull this one bag out of your personal item and place it in a bin by itself. You don't have to do this for pills, but it's a great habit that keeps things moving. For liquids, as we're about to see, it's a must. This strategy keeps you organized and streamlines the security process, making a time-consuming secondary search much less likely. Chapter 2: Decoding the TSA Liquid Rules. This is where so much confusion comes from: the liquid rules. We've all been trained to follow the 3-1-1 rule. Liquids must be in containers of 3.4 ounces or less, and they all have to fit in one quart-sized bag. But here's the most important thing you need to know. Medically necessary liquids, gels, and aerosols are exempt from the 3-1-1 rule. Your medications are not bound by that 3.4-ounce limit. You can bring them in quantities that are reasonable for your trip. This means you can bring your full-sized prescription eye drops, a large bottle of liquid medicine, your tube of prescription cream, or your injectable pens without having to pour them into tiny travel bottles. This exemption covers a huge range of items. Prescription liquids, things like liquid antibiotics, insulin, injectable medications, and prescription syrups. Over-the-counter liquids. This is where people get tripped up. Things like contact lens solution, saline nasal spray, and liquid pain relievers are all considered medically necessary. Gels and creams. Medical gels and creams are also exempt. This includes things like prescription eczemacreams, pain relief gels, and antibiotic ointments. Medical aerosols. Your inhalers for asthma are absolutely permitted. And related supplies. The exemption also covers things you need for your medicine, like freezer packs, gel packs, IV bags, pumps, and syringes. But there's a very important catch. You can't just leave a giant bottle of medicine in your bag and hope for the best. You absolutely must declare these items to a TSA officer at the checkpoint. Here's exactly what you do. As you get to security, take your medical go kit with your exempt liquids out of your personal item. Then verbally tell the officer, "I have medically necessary liquids to declare." Keep it simple and clear. Next, place your medical liquids in a separate bin for screening. Do not put them in your regular 3-1-1 toiletry bag. The TSA will then screen these items separately. This might involve an X-ray or a quick test. If you're not comfortable with your medication being X-rayed or opened, you have the right to request a visual inspection instead. Just ask the officer politely. By declaring your items, you're avoiding the surprise of the X-ray scanner flagging a big liquid in your bag, which is exactly the kind of delay we want to prevent. Okay, quick pause. If learning about the medical liquid exemption just lifted a huge weight off your shoulders, do me a favor and hit that like button below. It really helps the channel and lets me know I'm giving you useful info for your travels. Thanks for the support, and let's get back to it. Chapter 3: The Great Debate: Original Bottle versus Pill Organizer. This is one of the most common questions out there. Do I have to keep my pills in the original prescription bottles, or can I use a pill organizer? The answer is, it depends on where you're going and what you're carrying. Let's break it down. For domestic travel within the US, the TSA's main job is security, not pharmacy. Officially, they do not require you to have your medications in their original bottles. So for flights inside the US, you can legally use a pill organizer. You can bring as many pills as you need, as long as they go through screening. However, even though TSA allows it, you should know that some US states have their own laws about carrying unlabeled prescription drugs. The risk is very low, but it's something to be aware of. For international travel, this is where the rules flip, and a pill organizer can get you into real trouble. When you cross a border, you're subject to the laws of that country. Many countries demand that prescription meds be in their original, clearly labeled containers. A baggie of mystery pills is a huge red flag for customs and could lead to confiscation or serious questioning. For controlled substances, this is the most critical one. If you're traveling with a controlled substance, like certain medications for pain, anxiety, like Xanax, sleep, like ambien, or ADHD, like adderall, you should always keep them in their original prescription bottle, no matter what. That label is your legal proof that a doctor prescribed it to you. Without it, you're just carrying an unlabeled controlled substance, which is illegal. So, what's the best plan? I recommend a best of both worlds strategy. Use your pill organizer for convenience to stay on schedule, but also bring the original bottles with you. Pack them in your medical go kit. That way, if anyone asks, you can immediately show them the original bottle that matches the pills in your organizer. Also, always have a digital backup. Take clear photos of your prescription labels on your phone. Make sure your name, the medicine name, and the doctor's name are all visible. This can be a lifesaver if your meds get lost or stolen. Bottom line, while a pill organizer is usually fine for a quick domestic trip, the safest method for all travel, especially international, is to keep your pills in their original bottles. It's a small hassle that gives you a massive amount of protection. International travel landmines. Everything we've talked about so far has been mostly about TSA rules for leaving the US. But the moment you land in another country, it's a whole new ballgame. Assuming a drug that's legal in the US is legal everywhere is a dangerous mistake. Some countries have incredibly strict laws, and common American medications can be considered illegal controlled substances elsewhere. Breaking these laws, even by accident, can lead to your medicine being taken, heavy fines, or in rare cases, jail time. Here are a few examples that might surprise you. Japan is famously strict. Many common decongestants with pseudoephedrine, the stuff in Sudafed, are banned. ADHD medications like adderall are also heavily restricted and need special advance permission. The UAE has a long list of banned substances. Many common anti-anxiety meds, strong painkillers with codeine, and even some sleep aids require prior approval from their Ministry of Health. For Greece, anything containing codeine is highly regulated here. So how do you avoid these landmines? You have to do your homework. Here's your action plan. Check with the embassy. The best source of information is the embassy or consulate of the country you're visiting. Look on their website for rules about bringing in medication, or call them directly. Do this for every country you're visiting, even for layovers. Next, get a doctor's letter. For any prescription, but especially for controlled substances or injectables, carry a letter from your doctor on official letterhead. It should list your condition and the medications you take, both brand and generic names. Next, translate your documents. If you're traveling to a non-English speaking country, it's a smart move to get your prescription and doctor's letter translated into the local language. Also, only bring what you need. A good rule of thumb is to travel with no more than a 90-day supply. Pack enough for your trip, plus a few extra days for delays, but don't bring so much that it looks suspicious. Never ever assume. It's on you to know the laws of the country you're entering. A little research beforehand can save you from a total disaster. Chapter 4. Special medical equipment, CPAPs, insulin pumps, syringes, and more. Traveling with medical devices adds another layer, but the good news is that TSA and airlines deal with these all the time. The key, as always, is to know the drill. CPAP machines. If you use a CPAP machine, it's an essential medical device. Crucially, it does not mark count as your carry-on bag. You can bring it on board in addition to your normal carry-on and personal item. At security, you'll usually have to take the machine out of its case and put it in a bin. A great tip is to place it inside a clear plastic bag first to keep it clean. The mask and tubing can stay in the case. They might swab the machine, but it's a quick, standard procedure. Always pack your CPAP in your carry-on or personal item, never check it. Insulin, pumps, and diabetes supplies. For travelers with diabetes, all of your supplies, insulin, pumps, CGMs, syringes, needles, test strips, are permitted on the plane. Syringes are allowed as long as they are packed with the insulin or medication they're used with. To keep insulin cool, the TSA allows gel packs and ice packs. Here's the rule. Frozen items are allowed if they are frozen solid at screening. If they're slushy, they have to follow the 3-1-1 rule. However, there's a key exception. Medically necessary gel packs are allowed even if they're slushy or melted. Just be sure to declare them to the officer. Other injectables and syringes. The same rule applies to other injectable medications. As long as the needles are with the medicine they're for, they're allowed. Again, a doctor's note is your best friend here to prevent any questions. Wearable devices and implants. If you have an insulin pump, a CGM, or a metal implant, you should let the TSA officer know before you go through screening. You won't be asked to remove a wearable medical device, but they may do an additional pat-down or use a handheld wand. For any medical device, it's always smart to check your airline's specific policies ahead of time, especially if you plan to use it during the flight. Chapter 5. The Final Check. Knowledge is power, and the best way to kill travel anxiety is to get your info straight from the source. The TSA has excellent free resources that most travelers don't even know exist. The What Can I Bring tool. The TSA has a search tool on their website called What Can I Bring? You can type in any item, pills, insulin, CPAP machine, and it will give you the official packing rules for it. It's a fantastic way to get an immediate answer. The TSA Cares Helpline. This might be the most valuable and underused resource. TSA Cares is a helpline for travelers with disabilities or medical conditions. You can call them toll-free at 85-5787-2227. At least 72 hours before you fly to ask about your specific situation. They can give you peace of mind and even coordinate with agents at your airport. Using these resources means you're no longer guessing. You're taking control, and that lets you walk into the airport with the calm confidence of a pro. If you feel more prepared and less stressed about your next flight, please hit that subscribe button and turn on notifications. We post in-depth travel guides like this every week to help you travel smarter and safer. Finally, we want to hear from you. Leave a comment below and share your own experiences, good or bad, with traveling with medications. Travel safe, travel smart, and I'll see you in the next video. Thanks for watching.